I'm James Larkin. I'm a medical oncologist and I work at the Royal Marsden in London. There's been a lot of news in the media recently about melanoma. Melanoma is a disease that's quadrupled in incidence since the 1970s, and actually now it's the commonest cancer outside the top, the big four. And this is a disease actually that affects men more than women. It's curable in 80 or 90% of people in the early stages, but once it's spread, it has historically been difficult to treat. And one of the big stories in the last few years has been about the use of immunotherapy, new immunotherapy drugs to treat melanoma once it's spread. And I guess we've been using those drugs in clinical trials now for almost 10 years. And what we know about the first immunotherapy drug, which is called ipilimumab, or IPI, is that there's a group of people who've had this treatment who seem to have the ability or the possibility of living a long period of time after treatment. So we know that about 20% of people having had this treatment at 5 years will still be alive. And what I say to patients is that if you have this treatment and you're still doing well at 2 to 3 years, you've got a good chance of getting to 5 years, and I think a good chance of getting to 10 years as well. What we've seen in the last year or two with the immunotherapy drugs are newer immunotherapy drugs that, at least based on the data we've seen so far, seem to help more patients than IPI alone. And if we come right up to the present day, data were presented at the AACR meeting last weekend in New Orleans for the combination of IPI with another drug, nivolumab, showing that at 2 years, 69% of people were still alive who'd had that treatment. So it's early data and it's a small trial, but what we've been seeing very recently, I think, is encouraging for people who've got advanced melanoma. And I would say to anybody who's in this situation, it's important to seek out a team of people who are used to treating this disease, so that you can try and get the best possible treatment.